Autism Spectrum Disorder, ADHD, Intermittent Explosive Disorder, or Disruptive Mood Dysregulation Disorder. What is the diagnosis? Meet Mason, a 9-year-old boy who's constantly in trouble at school, but Mason gets good grades and does not struggle with focus. Mason is often in the timeout area. His teachers are overwhelmed and constantly reaching out to his parents. At home, things aren't any easier. Mason has sudden outbursts of anger that seem to come out of nowhere. His teachers describe his behavior as erratic and even scary. Between these episodes, Mason is moody, his head is low, and he has a constant frown. This has been going on for the last 2 years. His parents are exhausted, Mason is unhappy, and no one knows what to do. So what's the most likely diagnosis? First, let's rule out ADHD. You might think Mason's outbursts are impulsive, but there's no evidence of difficulties with concentration, so ADHD is likely not the diagnosis here. Next, we can rule out Autism Spectrum Disorder. While tantrums can be common for someone on the spectrum, there is not enough evidence here to make that call. A diagnosis requires more than speculation. That leaves Intermittent Explosive Disorder and Disruptive Mood Dysregulation Disorder. Both involve tantrums and complete loss of temper, but here is the key difference. In Intermittent Explosive Disorder, the person returns to a neutral mood after an outburst, sometimes even feeling guilt, and they can function happily in between episodes. In DMDD, the moodiness doesn't go away. Between tantrums, there's constant irritability and low mood. This means that Mason's most likely diagnosis is DMDD.